What's up guys, Kati Kleber here with Fresh RN, and I want to answer a question that I get all the time. Why are nurses so mean to nursing students? It happens, you know it. If you're a student, you feel it. If you are an experienced nurse, you remember how you felt in nursing school. You go to a hospital and you're assigned to nurses and they could not care less about you and are really unkind to you. Well, I'm gonna provide a little insight on why I think nurses are kind of mean to these students. Got a few reasons. Now, when I was a nursing student, I looked at the nurses on the unit with such awe, and I just wanted to know what they knew, and I was very kind, but they were not so kind back to me. And then I thought to myself, well, when I become a nurse, I'm gonna make time for those students. I'm gonna be kind. I'm gonna go out of my way for them. And then I became a new nurse. And I wasn't off orientation but a few weeks, and I had students with me. I barely knew what I was doing. I was hours behind. I knew my patient was on D5W, but I didn't know why. And I had a student asking me questions about it. And it was a painful reminder that I was not anywhere near where I thought I really should be to be at that point of being a registered nurse taking care of patients by myself. I felt very exposed and like vulnerable, having these bright-eyed students asking me all these questions and expecting me to know the answers, because I remembered being a student and I remembered expecting the nurses to understand these questions and these basic questions, what I thought were basic questions. And then I got there and I didn't know it. And I was also very behind. I was very inefficient. It took about a year or two for me to really get a great groove in with my time management, and also just being able to navigate when I didn't know something and how to handle that, or when I wasn't getting things done for an understandable reason, just being able to deal with that. Took me a while. It certainly wasn't when I had students a few weeks after orientation. And I was not advanced enough in my nursing skills and my communication skills to compassionately communicate that to the students, because I actually had a low level of awareness truly about what's going on. I'm like reflecting on this years later, that actually I shut down, was not as nice and was not as warm and welcoming as I could have been, because I felt really insecure. I don't think if you asked me that then I would have had the words to put to it, but now I do. And now I get it. And when I was working at the bedside up until like a year or two ago, I loved having students because I felt really comfortable in my role. I really understood the why behind a lot of things, and I felt confident enough in myself to be able to admit when I didn't know something, and I was okay with that. I was comfortable in my own skin finally. So I was in a much different place than I was when I was right out of school. And when you're right out of school, they're giving you students all the time. So I think and I'm not excusing people who are being unkind to you. I am trying to offer an explanation as to why that behavior might be happening. Now, granted, there are a lot of just not nice people out there, but I've observed in my years as a nurse that I think that insecurity and vulnerability has a lot more to do with nurses being quiet, shutting down, and also like taking out their insecurity on someone else who actually isn't, like while they don't have the cream of the crop role as the brand new nurse, they are technically above that nursing student, and that's someone they can feel better about being more prepared than. So I think people cope with that differently, and maybe not the healthiest and kindest and compassionate ways. I also think it's important to know, because I didn't understand operationally how this worked as a student. So nursing schools often will have clinicals at hospitals, and there'll be one clinical instructor and like 8 or 10 nursing students. But that clinical instructor can't be one-on-one with those 8 people. So what they do is pair the student with a patient, but that patient is a primary nurse, okay? So the primary nurse comes in that day with their patient load, and then all of a sudden they have 4 students or 3 students. And 3 different students have lots of questions for them at every turn, and where's this, where do I document this, how do I find this? And if you're a newer nurse and you're barely functioning and getting through a shift, and you have 3 bright-eyed students asking you questions all the time, You have just been given a lot of responsibility and more tasks, and you're not getting paid more. You're not getting more time to get other things done. You're actually given more work with the expectation that you need to get it done and help these students and teach them and somehow find time to get your stuff done, walk them through procedures that they're going to be even slower than you are with them because it's their first time, and make it all happen. And nobody tells you how to teach students. Nobody tells you how to have a student with you and really do that. And you're focused on just being able to get through your shift and not miss anything major. So it's a lot of pressure early on that you're not at all anticipating. Really expected to perform. So I think it's helpful to understand the mindset of the nurse at the bedside who is responsible for students. And again, not excusing people being unkind, but I think understanding a behavior is different than excusing it. And when you can understand and have a level of awareness of the situation, it can help you get more out of it and not take things personally that actually aren't really a personal thing against you. So I hope that helps clarify or maybe bring a bit of understanding in that complex dynamic of that really challenging culture that students are walking into, kind of unprepared and not knowing what to expect, along with another group of people who are overwhelmed, not knowing what to expect, and here now you're responsible for patients. So I encourage you, these are challenging environments to learn in, so all the best to you guys showing up every day, working hard, and trying to get the best out of it. So thank you guys so much, and stay fresh.